I was going in to sign up for health insurance and I noticed something very alarming, so buckle up. Both me and my husband are self-employed, and so every year we buy our healthcare on the marketplace. And because spreadsheets are my special interest, every single year I create a ridiculous spreadsheet of every single healthcare plan, of every single policy, of all of the costs, so that I can figure out what the cheapest option is for us based on what we expect to be paying for in healthcare and also what would happen if the shit hits the fan. Now this year I'm also having to factor in our child's healthcare costs because we have a 10-month-old, and I noticed that on the marketplace website for our state that the health insurance company that we currently have listed they were not going to cover well child visits and care anymore, which seemed like it was a mistake because I thought that was mandatory. The other plans in my state did say that they were going to provide full coverage for well child visits. So I called them today to figure out whether or not the pediatric care for my child would be now suddenly an out-of-pocket cost. And the answer that I was given was that pediatric care would be covered under preventative care. And the customer service agent directed me to the government website that defines what preventative care is. And while I was on the phone with her, I pulled up the other competing health insurance companies to verify that they were going to be providing this coverage. And what do you know? In the last 2 weeks, it's changed. And currently, none of the marketplace plans in the state of Maine list well child visits and care as a benefit. But the customer service agent assured me that, well, that's government mandated and it is included in preventative care, so it should still be covered. So why would all of these insurance companies suddenly switch and say that they're not going to cover well child visits anymore when they have to? And that is when I noticed that another change had been made to the marketplace's description of benefits. All of these plans added a phrase saying that what is considered preventative care is defined by federal law. Certain preventative services, as defined in federal law, are covered with no out-of-pocket costs to members when provided by a plan provider. And that's when it became very clear to me what was going on. It's pretty clear that what's happening here is that insurance companies are expecting that the Trump administration is going to roll back requirements for what they have to reimburse for. And when that happens, they don't want to be on the hook for the bill for your new baby's healthcare costs. How evil is that?